Hello. Hello and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff are delighted to be your source of information, resources, and health promotion programs that help maximize well-being and good health as we age. Today is Wednesday, July 1st. My name is Theo, and I'm part of the Rush Generations team. I'll be your moderator for today's lecture on mental health and aging. Before I present to everyone our wonderful speaker joining us today, first I would like to thank Hannah Weitzman, my coworker, for helping with the production of this lecture. She'll be helping us manage the chat and other key aspects so that we all can have a great discussion about mental health today and ways to build resilience. As always, we are live streaming this lecture through our YouTube channel using the video platform Zoom, which also allows us to host a good number of people who may be joining by phone, if not from YouTube. Thank you so much for joining us. For those of you who are on YouTube, we ask that you please use the chat feature to ask questions and to add anything throughout the discussion and throughout the lecture. We will make sure that your comments and questions get to the presenter. And for those of you listening on the phone, you will also have an opportunity at the end of the presentation to come off mute on your audio so that you can ask questions also. We'd like to remind everyone that all information that we offer here is for general information purposes, and we always recommend to seek additional professional guidance for any situations that are specific to you and your specific needs. And with that, we'll introduce our presenter for today. Welcome to Felicia Headley, Master of Social Work and licensed clinical social worker, who is in Illinois. And she earned her Bachelor of Social Work from Aurora University and Masters of Social Work from the University of Illinois at Chicago. Her professional experience has been rooted in community mental health, providing services to people across the lifespan from diverse backgrounds. Felicia currently works within an integrated healthcare system and is pursuing a Doctor of Social Work degree with a research focus on reducing social isolation and improving connection among young adults living with chronic illness. So welcome.
Thank you so much. Thank you. And thank you all for having me join today. As stated before, my name is Felicia Headley. I am a licensed clinical social worker. And today we'll be speaking about mental health and aging, and more so just providing an overview of what mental health looks like for this population. And we can go to the next slide. Next one. So before we begin, I want you all to close your eyes. Imagine waking up tomorrow and your daily routine is gone. Your coworkers are retired, your children are busy, and friends have moved or passed away, and your body doesn't move the way it used to. Who do you talk to? For many aging adults, this isn't imagination, but this is the reality. You may open your eyes. Next slide. So just to give an overview of what we'll discuss today, first we'll begin by exploring mental health in older adults, but we'll also explore some theories that closely relate to this population. In addition to that, we'll explore common diagnoses within this population, as well as risk factors and protective factors as well. We'll explore treatment option as it relates to micro, meso, and macro level support, as well as exploring key takeaways and resources as well. Next slide. And we can go to the next one. Awesome. And just to give an overview, aging is a natural part of development. It's something that all adults and all individuals will experience on their time on Earth. And according to the World Health Organization, 1.1 billion adults and people in this world are age 60 plus, and that number is expected to double by the year 2050. And the older adults in society play vital roles. They're leaders, they're community members, they're family members, they're pillars of this community, and they share so much wealth of knowledge as well as their own experience to those who are behind them. And in addition to the role that they play in society, they also experience their own life trajectories. So a lot of the older adults are retired now, they're empty nesters, so their children have grown up and have maybe moved away. They themselves have relocated, but also they find themselves navigating their identity, but their new sense of purpose as well. And additionally to these transitions and these trajectories that they're facing, there's also physical and environmental changes as well. So there's onsets of complex health concerns that they're experiencing, as well as just changes within the environment. So new technology and new normals that are happening all around them. And because of this, they experience a sense of grief. And the grief is just not about losing their loved ones, but also the loss of autonomy, the loss of freedom, and again, the idea of loss of themselves. And this can lead to individuals experiencing isolation and withdrawing from their supports. And because of this, there's an onset of mental health concerns. And according to the research, 1 in 5 older adults experience some form of a mental health concern. Next slide. And mental health is very unique to this population for various reasons. For one, there is a steady increase in older adults being diagnosed with different mental health concerns, with that number expected to reach 15 million by the year 2030. And the unfortunate part is that this population does not always seek support. So many times while they're battling depression and all these different concerns, they'll stay to themselves and will not receive the proper help that they need. Other distinct challenges that they face are changes in their medication regimen. So because the medication is changing, this can alter their mood and how they think. With that, there's change in their cognition, so how their brain processes certain information, also emotions. There's also major life changes that they face as well. So similar to what was mentioned before, they are retiring, they might be moving, but also significant losses as well. There's a loss of identity and autonomy. So what was their normal routine, they may not be able to fulfill anymore. But there's also this stigma associated with seeking help as well and mental health. So for certain population, the idea of having mental health concerns are taboo. Like for them, it's not something that is readily approached and spoken about. And because of that, they don't seek help. And even more so, this population is underrepresented in mental health research and treatment trials as well. Additionally to that, there's physical challenges too. So the body doesn't move and recover the same way it used to. So as a 20-year-old might be able to bounce back and recover quickly from an injury, someone that's in their older stages of life may not have that same ability to recover. However, there's so many different strengths with this population. So for one, they have decades of lived experiences, which has helped them build emotional regulation and being able to manage their mental health that way. They've had a strong sense of purpose because of various things that they've conquered and mastered within their lifetime, but also they've learned how to develop a deep sense of relationship that can help with managing the isolation. Next slide. And with this, there are various symptoms that you may see in an individual that's navigating mental health concerns. For example, you might notice a change in their mood and their appetite. So you might see more of a decrease in their appetite, as well as changes in their sleep. So you might see some insomnia as well with this population. Also increased worries. So they're seeing their friends move on, they're seeing people pass away. So they worry about what the next steps of their life may look like, and they're fearful because of this. This can also lead to symptoms of sadness and hopelessness, flat affect, so their countenance is different, changes in how they concentrate, how they think, also increased irritability. But something that's super important that we need to be mindful of is that there's an increase in suicidal ideation with this population. So really wanting to make sure that we're checking in with this population for sure. Next slide. So with this, there's two theories that I wanted to explore as it relates to the older adults, as well as when it comes to mental health as well. Next slide. So the first one that we're going to explore is life course theory. And life course theory is defined as a sociological method for looking at how various aspects of life shapes their path going forward. And there's three key concepts. So the first one being trajectory, and this is looking at the person across their lifetime. So from birth to where they are now, the highs and lows, as well as different events that may have occurred. We also have transitions. So these are the major life events that happens. So in the younger years, it might be career opportunities, marriage, having children. But as they get older, we are looking at retirement, the loss of a spouse, the onset of illness, and these can shape various patterns. But also there's cumulative disadvantages. So this may be poverties or other social determinant of health that greatly impact the population. And with this, especially when it comes to mental health in older adults, various life adversaries, so adverse childhood experiences, can impact their life and leave them more vulnerable to depression, anxiety, and other mental health concerns. But on the contrary, individuals that had positive life experiences tend to be more resilient and are able to overcome certain concerns that might happen later in life. But something that's so important to recognize is that interventions at any part of life, so being able to receive the treatment even early on, can help with creating better outcomes further on in life. And the next theory that I wanted to explore is activity theory. And activity theory is a framework which emphasizes the importance of maintaining physical activity and social engagement as individuals grow older. And there are a variety of activities that are included, including more informal ones, which is just connecting with friends, family, and neighbors. We have more formal type of groups, such as senior services and social groups within the community, faith groups, volunteering, but also hobbies. So this can include being creative in art and physical exercises. And the belief is the more that individuals engage in different activities, the less mental health concerns that they will experience. So for an example, the higher the activity level, the lower chances of having depression. Or the more that individuals are able to socialize, then they'll have better life satisfactory. And it's important to recognize that even though all individuals are different and all older adults are different, so we want to make sure that we're matching the activity to the individual's need. Next slide. So now we're going to explore different diagnoses that are common with the older adult population. And there are a wide range of them. So we will review some and just check in on some, and then we'll go into depth with others. So the first one that's here is anxiety disorder, and we'll touch base more on that in the next slide. But there's also depression that we'll also discuss later on. But in addition to that, we also have substance use and alcohol. And according to research, this is steadily growing in older adults, where they're seeing more of usage within this population. And most older adults use this as a coping skill. And according to research, there are about 1 million adults 65 plus that are living with substance use disorders. But substance uses can be linked to chronic respiratory conditions, but also depression as well. We're also seeing sleep disorders such as insomnia, restless leg syndrome, and sleep disorder breathing. And this can impact up to 50% of older adults. And this can be linked to many other mental health concerns as well. As mentioned earlier, there's also the sense of grief, whether it's losing members of family or within the community, but also their independence as well. But also bipolar is another diagnosis that we see too. And it's said that usually onset and later in life can be triggered by different medical events, but also changes in medication as well. And now we'll talk more about anxiety disorder. So anxiety disorder is very common in older adults and is characterized by excessive, persistent, and uncomfortable fears or anxiety that is disproportionate to the actual danger, causing severe distress. And different anxiety disorders include GAD, so this is your generalized anxiety disorders, phobias as well as agoraphobia, health anxieties, but also PTSD. And it said that anxiety disorders impact 10 to 20% of older adults, but it's more common in women than it is in men. The next thing I wanted to explore were the 3Ds. And what the 3Ds consist of, next slide. What the 3Ds consist of are delirium, depression, and dementia. And the reason why it's important to review these is because they're so similar in how they present themselves, but they are different. So we really want to take some time to review what the 3Ds are. So we'll begin with delirium, which is the next slide. So delirium is a sudden and severe state of confusion characterized by a rapid decline in attention, awareness, and cognitive functioning. And this onset is pretty rapid, and it can appear within hours to days, and the severity of it can fluctuate throughout the day, presenting worse at night. And delirium is more so seen in nursing home settings or long-term care facilities. And some of the risk factors that are associated with delirium include pain, dehydration, infections, stroke, and metabolic disturbances. And risk factors can lead to increased mortality, especially within the nursing home, long-term cognitive declines, as well as that loss of autonomy as well. And this diagnosis can be made by experienced clinicians using the DSM-5, but there's also a plethora of screening tools that are available too, such as the confusing assessment method for intensive care unit, so the CAM-ICU, but also the nursing delirium screening scale. And this can be administered by a trained nurse or staff to help with identifying if this is something that the adult has. And there are various interventions that can be helpful. Next slide. So one that I realized in researching was HELP. And HELP, it stands for Hospital Elder Life Program. And it was a cost-effective program to help with reducing some of the risk, but also maintaining the physical and cognitive functions. And other interventions that can be helpful is just lifestyle changes. So eating well, staying hydrated, getting nice, good amount of sleep, keeping the environment as consistent as possible, so limiting changes within the environment, but also support. So the more support that an individual have, this can also help with battling delirium. The next one that we'll explore is dementia. And dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that is severe enough to interfere with daily life. And some of the diagnosis that sits under this umbrella includes Alzheimer's, vascular dementia, and loose body dementia. And dementia is the most common out of all of them, as it accounts for 60 to 80% of dementia cases. And some of the signs include short-term memory loss, difficulty paying bills and keeping up with plans, remember to pick up various items, as well as meal preparation. And these symptoms can be progressive over time. And sometimes it's unrecognized in different physicians too. And sometimes they have a hard time recognizing it as well. The next one that we'll explore is depression. And depression is a common serious mood disorder that causes persistent feelings of sadness, emptiness, and a loss of interest in activities. And depression is the most prevalent mental health concern within the aging population. And according to data, 10 to 15% of older adults have clinical significant signs of depression. And similar to what I mentioned earlier in the PowerPoint, older adults have higher rates of suicidal ideation and suicide as well. And depression in older adults tend to be underdiagnosed and undertreated, more so because this population is not always seeking help, as mentioned before. And providers tend to feel like diagnosing depression 50% of the time. Next slide. So some of the risk factors to be mindful of include biological. So again, the body is changing. There's an onset of different complex health concerns, such as chronic pain, diabetes, neurological concerns. So important that we're being mindful of what is happening physically. There's also psychological concerns too. So if there's a history of mental health concerns, such as depression, that might also be present in older adulthood as well, and also the difficulty coping with loss and challenging negative thinking patterns. There's also social barriers as well too. So again, the self-isolation or the isolation due to the loss of peers, the loss of autonomy, but also financial stress with this age group can also create some risk factors and barriers as well. Also, environmental includes social determinants of health. So this is the lack of access to services and to different groups and programs in poverty, meals. These things can impact one's mental health as well. But there's one I really wanted to focus on just a little bit today, and that is isolation and loneliness. So loneliness impacts up to 43% of older adults. Again, they're experiencing so much loss and changes that they have a hard time with being able to manage some of the feelings that they're experiencing. And with this, this can double the risk of dementia within older adults. Also, research shows that 29% of individuals notice an increase in heart disease, especially because of that isolation and loneliness. But a report that I saw that I thought was so interesting, it said that loneliness is just as harmful or as dangerous as smoking. So that really puts into perspective how important it is to really address social isolation. And populations within the older adults that are at risk includes widows, so people who have lost their spouse or that's gone through a divorce, individuals experiencing mobility concerns. So if there's limitations, they may not be able to connect with different groups and resources. People who've outlived their social cycle, so for people who's outlived their friends and other individuals that they might have grown up in the community. This can increase a sense of loneliness. Individuals from rural populations where the accessibility is challenging because of different groups and services being further out. LGBTQ plus population and older folks, as there might be some stigma within that population, especially with the older adults. Individuals that experience cognitive declines, but also language barriers as well can create some concerns too. However, there are protective factors as well. So one of them being the social connection. So the more that an individual is able to connect with their social population and with those around them, the better that they're able to navigate their mental health and to become more resilient and work through what they're experiencing. Going back to the idea of activity theory, physical activity. So the more that an individual is able to get moving and really go for walks and exercise and engage, that can also decrease the feeling of depression as well. Having purpose. So when an individual has purpose or something that they look forward to in life, that reduces that risk of depression because it's something that they can do. And that can be even short term, whether it's looking forward to helping out at a local food pantry or connecting with other friends and other people within their circle. That can definitely help them as well. Cognitive engagement, so again, puzzles, reading, and various healthy activities can be so helpful, but also faith. So individuals that have a strong religious background or that are really connected to their spiritual being and their higher power, that can also reduce the risk of depression because they have something to look forward to again. Also managing chronic illnesses. So when the body feels a little bit better or there's a management over the physical, the mental also flourishes as well. So next, we're going to explore some strategies and supportive strategies to help with managing mental health. So I broke it down into three categories. So the first one being psychotherapy, and that encompasses a few different therapy methods. So the first one being CBT or cognitive behavioral therapy, and that focuses on changing the thoughts, feelings, and behaviors. So when individuals are able to reframe their thinking or explore various ways of managing their thoughts associated with their mental health or with different life trajectories, that can help them with feeling better and really working through some of their concerns. There's also problem-solving therapy, and that stems from that cognitive approach as well. We also have interpersonal therapy, which explores conflict resolution, navigating various transitions, but also improving communication skills as well. One that was new to me that I just learned about was reminiscence therapy. And from what I saw, this is very popular with older adults as it focuses on recalling past events, feelings, and thoughts to help them improve their well-being and psychological health as well. Medication can also be helpful too. So SSRIs have been helpful in managing depression and anxiety. And it's so important that this population really follows up with their providers, with psychiatry, to make sure that the medications are being monitored so that it's not having an adverse effect or developing other challenges. Then we also have integrative approaches too. And what I love about integrative approaches is that it explores like a holistic perspective to taking care of the mental health. So one being exercise therapy. So again, connecting to the theory of activity, where you're able to engage in aerobics and other exercises to help with calming the body, but also managing the mood. So you start to feel better the more that you move and exercise. Social prescribing is another good one. And social prescribing really explores the idea of connecting individuals with community programs. So rather than just prescribing medication, you're prescribing different activities like a farmer's market so that they're able to learn more about the nutrition and connect with other people. So that's a really great way to help with building that support. Pet therapy is another cool one as well. So when you're able to connect with pets and connect with animals, there's been shown to be a lot of benefits in individuals that have that connections. And it also helps with some of the brain chemistry and helping them to feel better. In alignment with that, we also have music and art. So when people are able to connect and tap into the creative aspect of their brain, that can also help with reducing not only the depression, but the anxiety as well, and overall sleep interventions. So the more that individuals are able to work on sleep hygiene and find healthy habits for managing how they sleep and just different their sleep cycle, that can help with feeling better as well too. Next slide. But it's important to note that there are barriers to treatment as well, for various reasons. So there's an article that I found that specifically identified some of the barriers that older adults identify. For one, not feeling the need for therapy. So this goes back to the stigmas that we mentioned earlier and just their belief on treatment. Again, not thinking that's going to be helpful because of maybe past experiences or what they've heard from others or just their own perspective and point of view, feeling embarrassed, but then also the cost aspect. So cost is a huge one that people get nervous about when it comes to receiving treatment, but also difficulty finding some providers too, and finding providers that fit your specific need. However, there are different ways to overcome these different barriers. One, education. So the more that we're able to educate and connect with our older adults and really help them understand how treatment could be helpful, that's one way to support them and get them connected to treatment. Exploring integrative care. So if someone already has an established connection with a primary care doctor or with a specialist that they like, if you're able to build that relationship through the providers and who they already have a relationship with, they might be more willing to seek care and be more accepting of it. Exploring different avenues. So there's also telehealth, which has been big, especially over the last couple of years. So if an individual is unable to connect via going in person, there's always telehealth too. And I know personally, I've had a few older adults that's connected through virtual, and they've liked it, and it's been a way of them being able to get their needs met. Exploring different coverage, especially with Medicare, and exploring what they're able to cover, but also exploring the sense of community, whether that's through community health workers, peer support, intergenerational connections that can also help with an individual getting their needs met, but also feeling supported and overcoming these barriers. Next slide. So there's different ways that we can help in different roles. So we'll go through a couple of the roles that and how we can help in these different ways. So the first one is as family members. What can we do as family members? So for one, watching for changes. So if you notice that your older adult that you have in your life is withdrawing or changing different habits, or you notice that they're forgetting things, it might be good to encourage them and explore ways that you can support them with getting their needs met. Listening without judging. So a lot of times older adults just want the space to express themselves, and sometimes they just want to vent about their life trajectory. So sometimes they want to express and discuss different experiences that they've had within their lifetime. And sometimes that helps them feel better too, because they're able to share their knowledge, share the wealth of what they've been through, and they just want that space to, be free and be open in that environment. Encouraging professional help. So again, allowing them and connecting them with different outlets and different ways to get that support that they need, but also staying connected. So whether that's regular phone calls or regular meetups. So it might be every Tuesday, you're having lunch with this individual and finding ways to build routine and structure around your check-ins with them. Taking care of yourself. So caregiver burnout, it's definitely real, and it can impact your own mental health concerns and your own physical body. So you want to make sure that you're taking care of yourself as you're supporting and taking care of your loved ones. And knowing when you need to advocate for more help. So again, if you notice that the individual is expressing increased suicidal ideation or increased like suicidal thoughts, you want to make sure that you are seeking additional support, whether that's through the 988 suicide hotline number or emergency services, getting them the help that they need. Next slide. And as a community, there's different ways to get involved and different approaches as well. So I may have mentioned this earlier, but senior centers. So they have like senior daycares, different senior programs, help getting them connected with that, just so that they have other people with lived experience that are in their age range that are also navigating their own concerns and connecting them that way. You'll see a good outcome with having that community for them. Again, the idea of social prescribing, so connecting them to community resources, but also peer support as well and different befriending programs. So similar to what I said earlier, the more that the individual is connected and feel that support, the more that they're able to build that resilience and manage their mental health concerns. Intergenerational programs. So a lot of times older adults love connecting with the young folks because it keeps them feeling young. And also, again, from the younger folks' perspective, it helps them to, again, gain more knowledge. So anytime you're ever able to build that connection, that's so important. As well as exploring transportation concerns. So whether that's through their insurance, sometimes for medical appointments, their insurance may cover transportation, but also exploring other programs that might be out there as well, and connecting digitally. Also, there are policies. I know that there's policies are ever changing. There's a lot of new policies and legislation that's developed. Some that are currently out there. So advocating the best way you can. And something that someone taught me is that if you're not able to get to federal government, start locally. So going to town hall meetings, writing letters to your local government, attending any sort of meetings and forums that they may have that way, advocating for funding, protecting older adults, doing what you can at the position that you're able to. So there's always something that we can do to advocate for different policies and needs that are important for this population. Next slide. So just to wrap things up, a few key takeaways I wanted to note. One, knowing that mental health is not quote unquote a normal part of aging. And there are different ways for individuals to get treatment. So depression is not a normal part of aging. Anxiety is not a normal part of it. So we want to make sure that we're getting their needs met. Again, knowing that depression and anxiety are very common and they can be underdiagnosed. So again, making sure that you're keeping your eye on your older adults and getting them the support that they need, encouraging that support. Knowing that loneliness and isolation are big risk factors. So we want to make sure that we're addressing that, as well as exploring different treatment options. So again, there's various different treatment therapies, medications are out there, there's social interventions. So really just connecting the individual at a space that meets their needs and meeting them where they are. Also knowing that yes, there are barriers, but there's definitely different ways to address those barriers. As well as knowing that as family members, as community members, as well as policyholders, there are so many different things that we can do to better support our older adults, the geriatric population, and creating a sense of wholeness for them, but also a sense of purpose too. Next slide. And these are a few resources that you all can take into account. So again, the National Suicide Hotline number, the 988 number, is 24 hours. So there's always someone available if someone just needs that additional support. As a loved one or a supporter, you can also get good resources and information if you call them as well too. So it doesn't have to just be for crisis, but can be for your own knowledge as well. There's also the National Institute on Mental Health, And there's a lot of research. So if you wanted to know more about the research and the data that's out there, this is a good avenue to explore. Nomni is good as they offer a lot of great resources as well. Whether it's through advocacy, they offer a lot of support groups, especially for depression and a lot of other mental health concerns. We got the SAMHSA, which is a great hotline as they more so support individuals struggling with substance use. So they're a great one. It's free to use and again, 24/7 services. We also have the elder care locator, as that can help with finding services for the population. But also there's the geriatric psychiatry database that you can connect with if you need to find a psychiatrist for your loved one as well. Next slide. Alrighty, so that's all I have for you all today. I'm hoping that something that was discussed here today either gave more insights or even just refresh any knowledge that you all have. And again, I thank you all for joining me today and giving me the opportunity to present to you. Thank you.
Thank you so much, Felicia. So we will roll into our question portion of the lecture today to learn a little bit more, but shared so much great information already. So a couple of options again to share questions. You can, if you're on YouTube, you can use the chat feature and type in any questions or notes there. And if you're calling in, you can press *6 on your phone to come off of mute and ask a question. We'll give folks a minute, but I have some questions too, depending on time. Well, in the spirit of getting us started, I have sort of a starting question, and then we can check and see if folks have questions too. We'll make sure to make some space for that. But yeah, speaking of a starting, what would you recommend as a phrase or a conversation starter for someone who's looking to start that conversation about mental health with a loved one?
Honestly, I feel like it's just about the basic check-in. So it might just honestly be just asking how are they doing? And if you're noticing any changes, it might be saying to them like, hey, I've noticed that over the last, X amount of time that it seems like you haven't been your cheerful self, or I've noticed that there's been some changes in how you've been responding to X, Y, and Z. What's been going on? So it might just be really just taking it from a place of, concern, letting them know what you've observed and allowing them that space to be able to express what they're seeing for themselves or to be able to open that dialogue with them.
Thank you. I want to pause and see if anyone would like to come off mute with a question or if we're seeing anything from our folks on YouTube. All right, looks like we might still be waiting in case there might be more questions, but another one that I'm curious about to maybe share a little bit more insight with folks about what the process is like to start therapy, maybe someone who's never tried therapy before or who's considering it. Could you tell us a little bit more what that process looks like before and during the first meeting?
No, definitely. So let me start by saying I know that starting therapy can be so nerve-wracking. And I tell my patients all the time that I know it's scary because you're about to tell your whole life business to someone that you've never met before. So I know that it is definitely nerve-wracking. So for an individual that is wanting to start therapy, I would say for sure, starting with what you're familiar with. And what I mean by that is it might be reaching out to your PCP as they might have a list of referrals or therapists that you might be that might be in their network, and they can probably give you some insight on what their treatment style is like and get you connected that way. So starting with established relationship and who you know. There's also different databases as well too. So especially for those who have insurance, that might have insurance, there's different databases online, such as Psychology Today, where you can look and kind of scope through the different therapist profiles to see if there is a therapist that you feel like might fit your needs or fit what you're looking for. And you can always reach out to them via the online database, or again, like through your PCP, or if there's a facility nearby that you know of, you can always reach out and ask for, if you want to meet with a specific therapist. So for an example, at my location I work at now, if people already see a primary doctor there, sometimes their doctors are able to inform them like, hey, we have a therapist, her name is Felicia, this is her specialty, are you interested? And they can get them connected that way. Or I've had clinicians that are looking for someone with my experience, and they'll reach out and say, hey, does Felicia have availability? I want to try therapy with her, and get connected that way. And in terms of the first session with the therapist, a lot of that is based on just building rapport. We really just want to get to know you all and really just understand what's bringing you to therapy. Our biggest thing is just making sure that we are able to support you and help you with whatever it is that you're coming in for. And as I said at the beginning, we know that it's scary. We know that it's not easy. And coming to therapy or you coming to see us is a big step in itself. We celebrate that. So we really just want to give you the space that first session is really just about getting to know you, really just giving the space to share what you want to share and having some dialogue around how we can best assist you.
Great. Thank you so much. And I'll share too from some of my experience that I've heard it can take 3 to up to 10 sessions to start to feel comfortable with a new
Yeah.
provider. So I think, having some grace to give some time, but thanks for all that great information. We do have a question that came in from the chat. Could you please maybe like read out or show again the phone number for elder care and explain a little bit more of what that resource includes, like what people might expect if they contact elder care?
Yeah, so give me 1 second. I can pull up the number one more time. I know I had it on my slide. Give me 2 seconds. So while I'm getting the number, a lot of times what elder care supports an individual with is really just locating different services that might be there. So again, if an individual is in need of, I'll say like food supply, or like if I can't speak today, in need of different like food services, they might be able to coordinate and connect you with a resource in the community or near you that provides that service. Or if there is an individual that maybe are looking for additional support with managing maybe their physical needs as well, they might be able to connect you with various services that are there. So I found the number. Okay, it's on the board too. So yeah, so they definitely just help with pretty much anything that your needs, any needs that you might have, whether it's, physical, whether it's in terms of taking care of the, daily basis, they can definitely help with providing support around that. Hopefully that helped answer the question.
Great. Thank you so much. Sounds like, yeah, a good hub to ask for a lot of different, information, questions, resources, and they can help point you in a good direction. Great.
Definitely.
Awesome. I wonder if we had any more questions. We might have time for maybe one or two more if anyone had any others. This has been great. And again, yeah, I know we had a question come in from the chat in YouTube, but if you are calling in, you can press star and then 6 to unmute if you have a question. All right, I think we might have time for like one more. Let me pull up my list. Oh, I know you mentioned earlier about sleep hygiene. So I'm curious, maybe a little bit more information about that, what that means, or maybe a couple of quick tips or tricks or strategies to support with sleep hygiene.
Yes, no, for sure. So I love talking about sleep hygiene because it's so important to our quality, our quality of life. So with our sleep, I know it's recommended that we get about 8 hours of sleep, but due to different situations or barriers, it might make it hard for us to get the amount of sleep that we need. So there's different like tools and tips that are out there that can help us with, again, managing our sleep or getting good sleep. So the one that, especially since I work a lot with teens, the one that I'm always speaking to them about is the phone. So how late are we on our phones, on our TVs, laptops, etc.? Because that blue light can disrupt our ability to sleep or our brain's ability to shut off so we can go to sleep. So it's recommended that at least an hour before you are trying to go to bed, that you turn off any sort of blue screen so that you're giving your body and your mind that time to process and get some good quality sleep. Um, Others include how late we're eating. So again, food has to process through our body. So if we're eating too late, then it may be harder for us to be able to digest the food. Again, food fuels us, so it gives us energy. So again, if we're eating too late at night, we're getting more energy. Our body's still trying to process it and digest it, and that might be harder for us to get quality of sleep. Other little tips that are recommended are having a routine with your sleep. So trying to have a consistent schedule of what time you're going to sleep. Changing the environment of your room. So like for some people, having the room a little cooler helps them to feel better and be able to get that good night's sleep. Or being mindful of what we're doing in our room. So if we are eating, relaxing in our room, just using it as our all over and all be all, that can make it hard for our body to know, like, hey, this is time for sleep. So it might be about being intentional about having your living room be like your relaxation spot and your bedroom being just for sleep. That way you're starting to train your mind that, okay, when I'm in this room, that means it's time for me to turn off and go to sleep. Also, just implementing different skills. So I am all about mindfulness and relaxation. So whether that is turning on a quick meditation at night and allowing your brain to just like get into that state of relaxation, following the different meditation activities that you're implementing, the deep breathing, so relaxing the body, relaxing the breathing, so that we're able to be calm and get that good night's sleep. Some people having a noise machine, so having white noises help them sleep. So there's so many different skills that can be helpful. And again, sleep hygiene is all about just creating a healthy environment for you to be able to get that 8-ish hours so that you can get that sleep that's needed.
Great. Well, thank you so much. About sleep hygiene and all the other topics you shared. What a great source of information and ideas for those tuning in and maybe who will watch later. So thank you so much for sharing.
Thank you. Thank you for having me.
And again, thank you for the lecture. And so now we will wrap up our lecture for today, talking a little bit more about some upcoming programs here with Rush Generations. So there's some tie-ins to a lot of the great themes that Felicia shared with us today. First, we have a program coming up starting next week, Tuesdays, July 7th through August 25th from 1 to 3 p.m. This program is called the Wellness Recovery Action Plan. It is a free 8-week program for anyone age 18 and older. Focuses on skills for daily wellness, staying well, a lot of themes around mental health, like what Felicia shared with us today, and making life more enjoyable. The workshop guides participants through developing daily wellness plans, using simple wellness tools, and creating plans for responding to stress and negative situations and thoughts and challenging times. And again, that next workshop will be Tuesdays, July 7th through August 25th, 1 to 3 p.m. It will be at one of our partner community senior centers, the Southeast or Atlas Center at 1767 East 79th Street. And to get more information or to register, you can call our helpline at 800 757 0202. And next, we have our Taking Charge of Your Health series. This program is a free 7-week workshop for anyone, again, age 18 and older. And this is for anyone with different ongoing health conditions and their loved ones. Participants build skills to gain confidence, better manage health, and lead an active and fulfilling life. This program includes several interactive topics, including personalized goal setting, nutrition, physical activity, medication and pain management, effective communication, and strategies for working with healthcare providers. The next one that we're offering will be in person at our Sankofa Wellness Center, and that's at 4305 West Madison in Chicago. It'll be on Tuesdays from August 18th to September 29th from 9:30 a.m. to 12 p.m. noon. And again, to get more information, talk more with one of our team members, or register, you can call 800 757 0202. And here we would love to hear more from you, anyone here on the call, and that is through our Shulman Senior Voices. So this program aims to empower older adults to discuss and share what matters most to them as they age. It is very important that we encourage sharing what matters most to us with our physicians, our healthcare providers, our loved ones. So Shulman Senior Voices does want to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and loved ones to know what your goals and wishes and what matters most to you are. And you can do that by scanning this QR code here on the slide. You can also go to aging.rush.edu, or you can again scan that QR code. There's also a shorter link you can go to record a story, which is bit.ly/record my story. And our next health lecture will be coming up Wednesday, July 15th at 1 p.m. on bone health. Thank you so much again to Felicia for the lecture and for everyone joining us. If you have any questions about the lecture or any programs discussed, and also if you're wondering or looking for more support in figuring out what different mental health providers or other types of providers or resources that Felicia discussed today, you can do any of those things by reaching out to us at 800 757 0202. You can also follow us on Facebook at facebook.com/rushgenerations. And we look forward to seeing you at the next lecture.